Good afternoon. My name is Eleane Hamburger. I'm a master's student in experimental surgery in the laboratories of Doctors Haglund and Rosenzweig. And today I will be talking about targeting senescent cancer cells by using senolytic drugs in order to prevent breast-to-bone metastasis. We hypothesize that by combining senolytics with the standard chemotherapeutic doxorubicin, SASP release, tumor size, and overall outgrowth will be greatly diminished. So what is senescence and why are we targeting this? Well, senescence is characterized by cell cycle arrest, distinct cellular changes in gene expression, metabolism, and chromatin organization, as well as changes in the anti-apoptotic pathway. All of this leads to the increase in tumor progression via the senescence-associated secretory phenotype, also known as SASP, which secretes pro-inflammatory and pro-tumorigenic factors, all leading to chronic inflammation, cell proliferation, cell invasion, as well as increased angiogenesis, which is the blood supply to the primary tumor. And all of this leads to tumor growth and metastasis. Drugs that we will be using. So doxorubicin, a standard chemotherapeutic, is a topoisomerase II inhibitor that leads to DNA damage and then apoptosis. The two senolytics we will be using are ovanillin and RG7112. Ovanillin is a natural anti-inflammatory senolytic, whereas RG7112 is a p53 MDM2 inhibitor. These drugs will be used alone and in combination with each other. The significance. Why are we studying this? Why is it worth the project? Well, it's been estimated that 50% of US patients dying annually of solid tumor cancers have bone involvement. Chemotherapeutic treatment causes the induction of senescent cells within and surrounding the solid tumor. And this project may offer a better understanding of cancer cell senescence and its relation to chemoresistance, chemosensitization, enhanced growth, and metastasis. How are we studying this? So first off, we're creating a tumor microenvironment model where we create tumor spheroids with cell lines. And then once we've created the spheroid, we surround it with collagen, as in the matrix, with surrounding cells, i.e. fibroblasts, to test the outgrowth of the tumor and the growth itself of the primary tumor. So what are we going to analyze? With fluorescent imaging, we'll measure the area and the outgrowth. We'll look at the viability and the activity of the cells with Alamar Blue and live dead assays. And we will collect media to look at the cytokine release and SASP effect. And we will also be staining for the increase of senescence, apoptosis, and proliferation. Preliminary results. So first off, we wanted to show that doxorubicin does in fact induce senescence, and with increased concentration of doxorubicin, you will see an increase of senescence within and surrounding the primary tumor within our model. So here you can see on the left that within the breast cancer cell line, there is an increase in senescence with increased doxorubicin. And then on the right is a fibroblast cell line, where again, you see an increase of senescence with an increase of the standard chemotherapeutic. Now, this is looking at the area and the outgrowth of our spheroids in this model, where you can see that in our model, doxorubicin does in fact reduce spheroid size as well as outgrowth, which means our model is working. Lastly, I wanted to show that viability and area is reduced greatly, and even more so significantly, when all drugs are used in combination rather than alone, and in comparison to doxorubicin alone or the control. In conclusion, the tumor microenvironment model, as previously described, can aid in answering questions related to chemosensitization and cancer relapse. Future testing will be done with patient-derived spine metastases secondary to breast cancer to allow further assessment for combination treatments. This project may lead to the generation of a new combination treatment that can target both cancerous and senescent cells within and surrounding the primary tumor to reduce overall growth, viability, migration, and recurrence of cancer. Thank you so much for listening.